Hello and welcome to Place the World. Today we have with us Mrs. Abby Dixon. Well, welcome to the show.
Thank you. It's a pleasure to be here.
Let's get started by having you tell the audience about yourself.
I'm Abby Dixon. I am a medical exercise specialist and a cancer exercise specialist. I am the owner of MetaFit Incorporated, which is a wellness and health studio in South Howard County in Laurel, Maryland. And I've been doing this for over 25 years, helping
Hmm.
individuals achieve wellness and take charge of their health through effective exercise and balanced nutrition.
Okay. Can you tell us what a medical exercise specialist does specifically?
Absolutely. A medical exercise specialist is an individual who has been specially trained to help individuals achieve their optimum quality of life through exercise and understanding how that integrates with good nutrition and helps a person who is struggling with a chronic illness or a individual who is recovering from, for example, a hip replacement, knee replacement, achieve their better quality of life in terms of maintaining their strength, building on their ability to do all of their normal activities of living without injury.
You know, I think that people really take that for granted. Unfortunately, people have gotten so used to the surgeries and the pills and all those other things that they have not really taken full advantage of what you do. So can you give me a couple of cases or a patient um, case study to kind of help people understand the before and after?
Yes, I can. For example, if a person has been diagnosed with type 2 diabetes and they are struggling with managing their blood sugar and their exercise, how that all integrates,
Hmm.
I would help a person understand how the benefits of cardiovascular exercise, strength training, flexibility training helps to improve their overall blood sugar profile and help them exercise without injury. To understand that they have to take good care of their feet to make sure that because diabetics have a tendency not to heal as well or as quickly as a person who does not have that condition, how to manage exercise through and a safer protocol than just pushing through. A lot of people will say, "Oh, I don't feel well. I'm just going to keep pushing through." But sometimes that's not always the best way to do things.
I agree completely, Abby. I don't know how many patients I've taken care of who ended up getting an amputation of a foot, and then that didn't heal well. They had amputation further and further up the leg. And so exercise is important, but safe exercise is really taken for granted. And I don't think that that is something that people really think about. The significance of being able to not only exercise, but exercising in a way that's going to improve their health, not create another problem for them. So that's the sort of thing that you explain to people.
Absolutely, and it's about prevention as well. I often will do a little foot check with my clients who are type 1 or type 2 diabetics and just ask them, let's take a look, let's make sure there's no swelling, there's no cuts or sores that you might not be aware of. And I actually had someone in, the last couple of years where I noticed that her one toe was a little red. And she said it had been bothering her, but she wasn't paying it much attention. And I was very concerned because it looked like it was very swollen and encouraged her to contact her doctor and to have it looked at. So she did go, and it turned out there was an infection in that toe.
Mm.
And the doctor immediately admitted her into the hospital and had her put on IV antibiotics. And it actually saved her toe. from amputation. So having good self-awareness
Hmm.
prior to starting any type of exercise program is very important. And there are times when clients will have swelling in their ankles, and I'll look and say, "Are you taking your medications? Let's go over your medication list." And if they're, very swollen, I'll want to make sure, are you taking a specific diuretic that your doctor prescribed? And if not, let's wait until we have the doctor check and make sure that you are safe to exercise, because we don't want anything to compound a situation that is taking place. And then we can move forward. We can do our stretching. We can do our cardio exercises that are that are safe and apply to them. And I'm very much a proponent of strength training, whether it is using weights or some of the equipment that I have in my studio. We do some Pilates as well to strengthen, as I say, strengthen and lengthen the body for to engage, so people can continue doing what they enjoy doing, whether it's gardening, golfing, taking care of their grandchildren, getting up and down off of the floor. There's so many things that we want to do, especially as we get older, that could continue if we are exercising safely.
Absolutely. Now, with the exercise regimen comes decreased stress. With decreased stress comes a decreased stress eating, better sleeping, an overall sense of well-being. So exercise is huge. People who stay active, are likely to live longer than those who do not. And so being able to exercise and do so in a way that they don't have to worry about falling and breaking a hip or, breaking a toe bone or something. Those things are tremendous. So what
Yes,
about, okay, go ahead.
go ahead.
Tell us a little bit about a cancer exercise specialist.
A cancer exercise specialist is also an individual who is specially trained to work specifically with individuals or small groups of patients who are either in treatment or post-treatment. We also will help a person who is preparing for a surgery, if it's a breast cancer diagnosis, to build the core. So if they're having reconstructive surgery, that core is nice and strong, to enable the surgeon to better do the reconstructive work that has to take place. We also help individuals understand the process of how movement can affect their body, educating about lymphedema and all of the things that a person would have to be aware of as they are starting an exercise program, especially after surgery, radiation, or chemotherapy. Because chemotherapy can have some negative effects for the heart or the lungs. So as a cancer exercise specialist, and I'm certified through the Cancer Exercise Training Institute, we learn and are trained to know the gamut of many, if not all, cancers, and how the different chemotherapies, radiation can affect the human body and physiology in general. And there are so many gamuts of this that I can't even go into, but I can tell you that if you are going through cancer or have been through cancer treatment, it's really important once you want to go back into an exercise program or begin an exercise program that you contact someone like myself who is specialized in working with this population.
You thought I did notice several certifications. Can you go over all of those certifications for us?
Yes. Well, first, I'm certified through the Medical Exercise Training Institute as a medical exercise specialist and a post-rehab conditioning specialist. And I also am certified with the Cancer Exercise Training Institute as a cancer exercise specialist. I'm ACE Gold certified health and advanced health and wellness coach, and that encompasses four main certifications, which include personal training, group fitness, um, advanced health and coaching, basically health coaching and clinical exercise. I am also certified as a Pilates instructor, and I also am an instructor with Body and Soul Fitness and qualified to teach 5 programs for that organization. I,
Two of you. A great deal of expertise. That's incredible. So let's talk a little bit about movement is medicine. Why do you say that?
well, because it's true. And I'll have, I do teach a few small group classes during the week, and I will teach, I have a senior fitness class called Golden Girls. It's a great group of gals.
Mm-hmm.
And sometimes people will come into the room and say, oh, my shoulder hurts, or I feel kind of down in the dumps, or my knee is hurting me, or, just general aches and pains. And we get to moving, we get to moving our shoulders and doing some breathing exercises and some balance work. And I always hear at the end of those classes, I feel so much better because we move the blood through the joints, through the extremities, our organs, our heart was pumping a little faster, and the endorphins kick in, and you just start to feel the effects of movement. We were designed to move, not to sit
Mm-hmm.
and be stagnant. And the benefits of exercise are so well documented across the whole field of exercise physiology and mental health. So movement is medicine.
I agree. I absolutely agree. It makes a huge difference. And when your brain starts releasing these chemicals that go to, or your body releases chemicals that go to the parts of the brain that makes you feel good, that's just an added bonus in addition to all of the health benefits. About your most memorable patient,
Oh, wow.
or one
There's
of them.
so many amazing, there's so many amazing clients and individuals that I have worked with. I think I mentioned just before we went on that I have a client who has recently retired in the last few years with a few complicated medical conditions and had never really engaged in a formal exercise program. But he was determined once he retired that he was going to, with a pacemaker and a defibrillator and another type of autoimmune condition, just learning how to pace himself to be able to move slowly but progressively. He personally is an avid gardener and would just run out of steam after a half hour of pulling out weeds. And now he told me he was in the garden recently for 3 hours, was feeling great, doing all the right things, hydrating, stretching before and after, learning how to do the right biomechanics, doing a squat instead of bending over to pull a weed out, or the proper mechanics to dig with his shovel. Um, he is one of those success stories of someone who is very determined to make sure that he has quality of life into his 70s and 80s so that he can enjoy his grandchildren and the things that are important to him. I have other clients who are breast cancer survivors who are doing really well because they've learned the right way to manage their exercise, the way they move, and manage their health through healthier nutritional choices that they have felt that this type of program has empowered them to move forward with their lives.
We're going to take a quick break. We'll be right back.
It's a new day for health and wellness, and it begins at Patient World. Empower yourself with fun and engaging on-demand courses taught by doctors and other experts at patientworld.net today.
Welcome back to Patient World. We have with us our special guest, Mrs. Abby Dixon, and she's giving us a lot of useful information that most people, including a lot of physicians, are not aware of. So, Abby, tell us what the typical patient is that would benefit from your services.
A typical patient would be someone who is either very deconditioned and needs someone who is specializing in a medical condition that they may be challenged with. They could have recently had a diagnosis of osteoporosis, and their doctor said, "You need to exercise." And they're like, "I don't even know where to start."
Mm.
Or they have belonged to a gym and experienced an injury because they weren't sure how to use properly the equipment or didn't have the supervision that they needed to do it in an effective way without injury. Or an individual, as we spoke, who's been diagnosed with diabetes or an autoimmune condition such as lupus or Crohn's or even MS, someone who is working through diabetes and or someone who has been told they have a cancer surgery or going to be going through a radiation process and future surgery. Then the person who is post-surgical, who has had a joint replacement, a shoulder or a hip or knee replacement. And they have gone through the acute phases of physical therapy, but now it's time for them to just get back into their life and they want to continue with their activities, but there are still residual deficits from their surgery or from the compensating before their surgery or from their treatment. So there may be times where they need help in their gait or with mobility, with balance, with strength, with building endurance. So those are a good number of the types of persons that I would be helping and serving in my work.
Well, we are dealing with this huge obesity epidemic. Fortunately, we're learning more and more about obesity. When I was in medical school, the idea was calories in, calories out. If you're overweight, it's your fault. That's not what we're looking at now. We now know that there's a whole lot more to it. The hunger hormones, certain processed foods being toxic to the metabolic brain cells. There's so much going on, and I'm really excited that we're moving past the archaic mindset, but still a lot of people are dealing with obesity. So tell the audience what you do with individuals who are struggling with this condition.
Well, I want to let each person know that they are an individual that is very valuable and that their struggle is very understood. And a lot of the individuals who deal with obesity deal with a lot of emotional challenges, rejection, and guilt, and shame. So I want to establish a relationship where I can help them feel that they can take charge of their health and feel better. And that I always say, little steps make big strides. So let's just start with one area of where we can be successful. I will often ask a person to, let's just talk about food a little bit, and let's just talk about what you like to eat, what you feel is healthy for you. But as we move into the exercise component, I just want them to feel successful in doing a set of bicep curls and rotate their shoulders and learn to release some tension in their shoulders and teach them how they can get their heart rate up sitting in a chair and using stretch bands to strengthen their ligaments and their tendons to support building muscular endurance. And then emphasizing the importance of consistency and giving them things, and then the person exercises and things that they can do at home that they can incorporate into their daily activities. Even doing heel raises, standing in front of their um, microwave, waiting for something to warm up, doing some heel raises and some gentle stretches. Little steps make big strides. Trying to help people understand that it doesn't have to be this one hard workout every single day. It's incorporating movement into every aspect of our lives and making it a lifestyle, making it a habit that is something that is normal. I'll say, well, you brush your teeth, we brush our teeth, we wash our face, we do some movement. each day, and sometimes a couple times a day, slowly changing the mindset that people will have that exercise has to be hard and painful and miserable because it isn't. It's very rewarding.
The world is all about the patient, all aspects, the emotional, the physical, and everything, the whole gamut. And as a physician, I've been a physician for a few decades. What you're doing is invaluable. I wish more people knew about this because I've been at the other end where I'm admitting a person to the hospital after an injury, or I'm telling a person, you need to, or some other horrible news.
Yeah.
But if people were able to incorporate what you bring to the table into their lives, that can have such a tremendous impact on so many people. So let me ask you this. I understand, I know you're in Howard County, Maryland, and I have known you for quite a while, and I have no hesitation whatsoever about recommending you because not only your expertise, but knowing you as a person. How can people contact you? And tell us about the online offerings that you have.
Well, my website is www.medifit, medifitnow.com, medifitnow.com. And you can go on that website and there'll be a link to classes that I offer. My classes are both in studio and hybrid on Zoom. So I have a variety of different types of classes that a person can check into. I also do one-on-one with clients on Zoom virtually. So if a person's out of state or if there's inclement weather, we can do it virtually. So those are some of the classes I offer. When I see a person who contacts me about starting a supervised exercise program, I will have them come in. We will do a full assessment, postural assessment. We'll go over their medical history. I do not only a postural assessment, but I'll do a strength assessment, flexibility, short-term cardio, just a heart rate, just to check over their general level of fitness so that we can start from that point on. And so, like I said, we can do it in person. I can do it on Zoom. So that's how we introduce myself to clients through the website. But I do have doctors and chiropractors who have referred clients to me over the many years, and also word of mouth from clients who have benefited from our services. So
In closing, I want you to give them the website one more time.
it's www.medifitnow.com, medifitnow.com.
Great. Is there anything that you want to leave the audience with today?
I just want to encourage our listeners today to feel that they can take charge of their health through effective exercise and safe and balanced nutrition. That movement truly is medicine, and it is a key component to having a good quality of life. And I just want to encourage everyone to think about how they can acquire a good, healthy lifestyle to prevent injury, to prevent illnesses, or to maintain a better quality of life if you're diagnosed with a condition. So thank you so much for inviting me today to be your guest. It was such a pleasure.
And the field that you're in is so underutilized, so underappreciated. A lot of people just don't know anything about it. I mean, you're the one who taught me about it. I didn't know that it existed, and I practiced medicine for close to 30 years.
Yeah.
So you can only imagine how many patients could benefit from your service if they only knew that there was such a service. I appreciate you coming on and educating people about the importance.
Well, thank you so much. And I hope you'll come by and see the studio sometime soon.
I will. And tell hubby I said hello.
I sure will. And you tell your hubby I said hello.
See you next week.
You, God bless you. Take care.
God bless you too. Bye bye.